I'd say the most interesting patient that I think had the most profound impact on her life was a 55-year-old gentleman that had a history of stroke in his past. He wasn't feeling well one day, very vague symptoms. The next day he completely collapses. His wife calls 911. The paramedics arrive on the scene. They find that he's completely unconscious, so they intubate him, paralyze him, and sedate him, and then bring him to my emergency department. Knowing that he had a stroke in the past, I assumed naturally he was having another stroke at this point in time. So I quickly called for the neurology team to come see and assess the patient. We got the gentleman into the CAT scanner within 10-15 minutes of his arrival. When I went to follow up on a patient and I looked at the preliminary CAT scan of his head, I could see obviously that stroke wasn't what had caused his major collapse. Only about 10 minutes later, I realized that it was not a stroke, but maybe sepsis. But now I had to once again expand my differential diagnosis and consider something called pulmonary embolism. At this point in time, I could see that the heart was working within its normal limits. It was maybe beating a little bit slower than normal, but I didn't see the specific changes of the heart that one would expect in a pulmonary embolism. Looking down towards the patient's feet, I could see that his abdomen had become about twice the size that it was when he initially came into the emergency department. So quite nervously, I slid the ultrasound probe down over his abdomen, and I realized that his aorta, which is the largest blood vessel coming off the heart, was about 10 to 12 centimeters in size. Normal size should be about 3 or 4 centimeters. And I quickly realized what had happened, that he had a dissection in his aortic aneurysm, and then subsequently became hypotensive as a result. From the time that that patient came to our doorstep to the time that he went to the operating room table was less than an hour and 20 minutes. The gentleman subsequently walked out of the hospital about 10 days later. Had I not been on shift or had not been able to respond as quickly as I did to his initial arrival, I don't think that man would be alive today.